only on 710 KURV.
Joining us on 710 KURV, Dr. Freda Levy, Medical Director of the Kidney Stone Clinic at Dallas Nephrology Associates at Dallas, Texas. Dr. Levy, it's a pleasure. How are you?
I'm great. How are you this morning?
Great. So there was an article the other day. I found this interesting. It said that summer you see an increase in kidney stones. Why is that, doctor?
It is likely that the stones had already started forming, but with the summer heat and people being outside more fluid losses, the stones may be starting to grow in the summer, and then people develop symptoms from them.
Is it possible that the hot temperatures and all the people, downing more water, that might increase the chance of dislodging these things?
I don't think the water itself, but certainly people drink more sugar beverages than in the past, larger size beverages, and the sugar content can increase the calcium in the urine and sometimes the oxalate in the urine, and both of these can be risks for stone formation.
Is that the only thing that causes kidney stones, is what you drink?
No, it's not just what you drink. There are inherited causes, and certainly if you have a family history of kidney stones, it's twice as likely that you will develop stones yourself. There are other dietary risk factors, such as a high protein intake, animal protein intake. Every 10 years or so, when there's a new high protein diet, we see more kidney stones.
Dr. Freda Levy from the Kidney Stone Clinic at Dallas Nephrology Associates, North Texas, our guest right now on 710 KURV.
Yeah, Dr. Levy, Tim Sullivan here. So when you say a high-protein diet, what do you mean, and what can people do then to reduce their risk of getting kidney stones?
A high-protein diet means a lot of beef, chicken, fish, or pork.
And protein shakes?
And protein shakes as well.
Very popular.
And to decrease one's risk for kidney stones, the best things are to drink more water. Adding lemon juice to your water is felt to be helpful.
Really?
A more plant-based or vegetarian diet. Now, there are some vegetables and fruits that can increase oxalate, so limit one's intake of spinach, rhubarb, beets. Don't overdo nuts if one has a risk for stones.
How do you know when you're eating too much protein that could cause kidney stones? You're eating too many nuts and too much of the certain fruits and vegetables that you're talking about that could increase your risk.
You will know when you develop the pain from a kidney stone.
I know, but before that.
But it varies from person to person, right, doctor? It does vary from person to person, though, right?
It does. There are certainly many people who eat a high-protein diet and do not develop kidney stones.
Yeah.
But the way we evaluate people with recurrent kidney stones to figure out why is to do 24-hour urine collection.
Okay. I got to ask you this before I let you go, doctor. Just a curious question. I'm just going to throw it out there. Somebody called me asking, gout and kidney stones, any connection, diabetes, anything like that?
Absolutely. Both are related to kidney stone formation. Persons with gout have increased production of uric acid in their blood. They also may have an acid urine and excrete more uric acid in their urine, so that is a risk for kidney stones. Diabetics also tend to have a more acid urine, and both of these, the gout and diabetes, can then increase the risk for uric acid stones, and a low urinary citrate inhibits stones from forming.
Interesting information. Dr. Freda Levy, thank you much for your time from the Kidney Stone Clinic in North Texas, Dallas Nephrology Associates.